Welcome to MO Module Selangor. We, from the Hulu Selangor FMS team, will be presenting on common eye conditions in primary care. This module will be divided into two presentations. In the first part of this module, we will be covering the basics of eye anatomy, history taking an eye examination in primary care, eyelid disorders, and conditions that cause red eye. Then we will move on to the second part of the module where we'll be discussing painful loss of vision, eye emergencies, and eye referral pathway. Eye-related complaints are among the most common reasons patients visit primary care. They can significantly impact daily life and, if untreated, may lead to severe complications. Early recognition and appropriate management can prevent disease progression and reduce complications. To understand eye diseases better, we would start with the eye anatomy. The next two slides shows the anterior and cross-sectional views of the eye. In this slide, we are seeing the anterior structures of the eye, namely the eyelids, conjunctiva, cornea, iris, limbus, and pupils. This slide shows us the cross-sectional view of the eye anatomy. The anterior segment of the eye consists of structures from cornea until the lens. The posterior segments are structures up the lens, such as the vitreous humor, retina, macula, and optic nerve. This is a picture of retina that we normally visualize through a fundus camera or ophthalmoscope. It is important for every one of us to identify the normal structures of the retina, namely the optic disc, macula, and fovea, in order to identify abnormalities associated with it. Effective history taking is crucial in diagnosing eye conditions. Key questions focus on symptoms such as pain, redness, vision changes, halos, and photophobia. For each of the symptoms, we need to ask the duration and severity of the symptoms. Collateral history regarding sick contact, trauma, exposure to chemical, usage of contact lens, symptoms of nausea and vomiting, and drug history is also important. A systematic approach to eye examination includes assessing visual acuity, optic nerve function, red reflex, extraocular movements, and anterior and posterior segment structures. On this slide, you can see the link to a video from Geeky Medics that demonstrates the eye examination step by step. Next, we will move on to the eye disorders. We will start with common eyelid disorders. Meibomitis is a chronic inflammation of the meibomian glands, which are the oil-producing glands located in our eyelids. These glands play a crucial role in maintaining a healthy tear film and preventing dryness in the eyes. This condition can present with several uncomfortable symptoms including burning sensation, inflamed and swollen eyelids, flaky skin on the eyelids, and photosensitivity. Management includes applying warm compresses to the eyelids and gently massaging them helps to unblock the meibomian glands and improve oil flow. Lubricant ointments help prevent dryness and in severe cases, topical and systemic antibiotics used to reduce inflammation and infection. Chalazion, also known as internal hordeolum, is a granuloma that forms in the eyelid due to a blocked meibomian gland. Chalazion typically presents with a nodule or lump on the eyelid that can cause discomfort. Pain may occur if a secondary infection develops, although not all chalazions are painful. Management of a chalazion depends on its severity and duration. During initial presentation, warm compression can be advised. This helps to unblock the meibomian gland by softening and draining the contents of the granuloma. In cases where the chalazion does not resolve with conservative measures, surgical incision and curettage may be required to remove the lesion. Next, we move on to stye or external hordeolum. A stye is an infection of the zes or mole sebaceous glands located at the edge of the eyelid. These glands are responsible for lubricating the eyelashes, but when infected, they cause localized inflammation and discomfort. The common symptoms of a stye include swelling of the eyelid, redness in the affected area, and pain or tenderness, especially when touching the eyelid. Treatment consists of warm compression, gentle massage, topical antibiotics, or oral antibiotics if there is a concern of cellulitis. Incision and drainage needed in severe cases. Blepharitis is the inflammation of the eyelids, presents mainly with the redness and crusting of the eyelids. Patients presenting with such condition can be advised for gentle cleansing of the eyelid margin twice a day with a cotton swab dipped in a dilute solution of baby shampoo or with commercially available wipes. A topical antibiotic ointment may be added in patients who are unresponsive to weeks of eyelid hygiene. In patients with recurrent or refractory symptoms, oral antibiotics such as azithromycin or tetracycline are prescribed by the ophthalmologist. A drooping eyelid is called ptosis. Ptosis may be present at birth or may be acquired later in life. Ptosis can affect one eye or both eyes. If a droopy eyelid is present at birth or within the first year of life, the condition is called congenital ptosis. However, any ptosis that develops over a period of days or weeks can signal a serious medical problem such as third cranial nerve palsy, Horner syndrome, myasthenia gravis, tumor infiltration, or other neurological conditions. Pupil anisocoria and reduced extraocular movements are red flags that points towards serious pathology. Proptosis, on the other hand, is the protrusion of eyeballs from its natural position. Conditions such as Graves' disease, cavernous sinus fistula, cavernous sinus thrombosis, and retroorbital tumor can cause proptosis. CT or MRI orbit could be useful tools to identify the underlying pathology. Treatment is based on the underlying cause. Herpes zoster ophthalmicus is a condition that we sometimes encounter in our clinics, caused by the herpes zoster virus. Patients normally present with pain and vesicles along the area of distribution of ophthalmic branch of fifth nerve. Hutchinson's sign is a rash on the tip of the nose that indicates herpes zoster ophthalmicus. It's a strong indicator of ocular complications such as uveitis, keratitis, and blindness. Early treatment with antivirals like acyclovir will reduce the ocular complications. Referral to ophthalmologist is indicated. Next, we will move on to the condition that causes red eye. Red eye is one of the most frequent symptoms seen in primary care. It can be a symptom of various underlying conditions, ranging from mild issues like dryness or allergies to more serious problems such as infections or intraocular inflammation. Non-vision threatening conditions that present with red eye are conditions like blepharitis, subconjunctival hemorrhage, conjunctivitis, dry eyes, and corneal abrasion. Subconjunctival hemorrhage is a benign, generally painless condition which refers to the rupture of blood vessels in the subconjunctival space located between the superficial conjunctiva and the Tenon's capsule. Patients usually come with preceding history of trauma or strain like a vigorous cough. It is usually harmless and often heals on its own. Conjunctivitis is the most common eye condition seen in primary care clinics on a day-to-day basis. It is characterized by dilatation of the conjunctival vessels, resulting in hyperemia and edema of the conjunctiva, typically with associated discharge. Conjunctivitis can be further divided into non-infectious and infectious cause. The most common cause of non-infectious conjunctivitis is allergy. Patients with allergic conjunctivitis normally has history of current or previous non-ocular allergy or atopic conditions. The treatment consists of allergen avoidance and topical or systemic antihistamines. Viral is the most common cause of infectious conjunctivitis in adult population. It is highly contagious. Patients commonly report contact with an individual with a red eye with watery discharge, or they may have a history of recent symptoms of an upper respiratory tract infection. Although no effective treatment exists, artificial tears, topical antihistamines, or cold compresses may be useful in alleviating some of the symptoms. Bacterial conjunctivitis, on the other hand, presents with signs and symptoms of red eye and purulent discharge. There is often accompanying eyelid swelling and eye pain on palpation. It is normally treated with topical antibiotics such as chloramphenicol eye drops or ointment, which is available in our clinic kesihatan. Advice on proper hand hygiene and avoidance of sharing towels and pillows should be given. Artificial tear drops can be used to relieve discomfort. Dry eye is a multifactorial condition that occurs as a result of reduction in quality or quantity of tear production. It is sometimes referred to as tear film dysfunction. The most prominent symptom is tearing. Other symptoms are burning sensation, itching, pretty eyes, redness, and blurring of vision. The management consists of artificial tears, warm compresses, and eyelid or eyelash scrub. Longer-acting agents such as artificial tear gel and ointments are preferred. Severe cases are referred to ophthalmologists for further management. Corneal abrasion is caused by superficial scratch or trauma to the cornea, resulting in focal areas of epithelial loss. It could be due to mechanical injuries such as scratch from nail and lens, prolonged exposure in neurotropic conditions like Bell's palsy, or infections. Symptoms include pain, tearing, foreign body sensation, blurry vision, redness, and photophobia. In order to visualize the epithelial defect, fluorescent strips after an instillation of the topical anesthetics are used. Fluorescent does not stain intact corneal epithelium but does stain corneal stroma, that demarcating the area of epithelial loss. Patient can be treated with topical antibiotics, artificial tears, and advised against rubbing the eyes. Red eye conditions that cause threat to vision are corneal ulcer, acute angle closure glaucoma, uveitis, Scleritis, and endophthalmitis. Corneal ulcer or keratitis refers to infection of the cornea. Although infectious ulcers may be also due to fungus, viruses, mycobacteria, and protozoa, bacteria are the most common cause of infectious keratitis. The most common risk factor for bacterial keratitis is contact lens wear. Other predisposing factors including trauma, foreign bodies, and chemical and thermal injuries, and contaminated ocular solutions. Symptoms include rapid onset of ocular pain, redness, photophobia, discharge, and decreased vision. Patients should be asked about contact lens wear, history of eye trauma, and eye surgeries. Signs of bacterial keratitis might include conjunctival injection and focal white infiltrates. Immediate referral to ophthalmology should be made as it can lead to cornea thinning, perforation, scarring, endophthalmitis, and permanent vision loss loss if untreated. Acute angle closure glaucoma is a condition that should not be missed when present to our primary care clinic. It is caused by sudden increase in intraocular pressure due to blocked drainage of the aqueous fluid. This disease has a familial tendency and is associated with increasing age and hyperopia. Patients may present with sudden onset of symptoms such as eye redness, blurred vision, halos around lights, or even transient loss of vision. They often have intense pain that may be localized to the eye, may follow the trigeminal distribution, or may be described as diffuse discomfort. Nausea and vomiting are common. On examination, the conjunctiva is significantly injected, pupil is mid-dilated, cornea is edematous, and anterior chamber is shallow. Patient should be referred immediately to ophthalmologist for tonometry and slit lamp examination to confirm diagnosis. The ophthalmologist will bring down the intraocular pressure with glaucoma medication and perform a iridotomy to prevent further damage to the optic nerve and vision loss. Uveitis is the inflammation of the uvea. Uveitis may arise spontaneously, have a genetic component, or be associated with an autoimmune disease or infection. Symptoms include eye pain, eye redness, floaters, and blurred vision. Examination may reveal circumcorneal eye redness, a small or irregular pupil due to posterior synechiae, and keratic precipitates. Uveitis is an ophthalmic emergency that requires urgent control of the inflammation to prevent vision loss. Keratitis is a serious inflammatory disease that affects the white outer coating of the eye, known as the sclera. It could be associated with autoimmune diseases such as rheumatoid arthritis or can occur post-surgery such as pterygium excision. Symptoms of scleritis are eye redness, sometimes changing to a purple hue, and severe ocular pain which may radiate to the temple or jaw. The pain is often described as deep or boring. Photophobia, tearing, and decrease in visual acuity are other important symptoms. Urgent referral to ophthalmology needed as it may cause vision deterioration due to posterior scleritis or scleral perforation. Endophthalmitis is a purulent inflammation of the intraocular fluids, namely the vitreous and aqueous fluid, usually due to infection. It is a very serious intraocular condition that results in vision loss or loss of the eye itself if not treated immediately. The causes are classified into exogenous and endogenous causes. In exogenous endophthalmitis, the infection is directly introduced through procedures like cataract surgery or penetrating trauma. In endogenous endophthalmitis, the organisms are carried by blood vessels to the eye from another site of infection, and it is most commonly occurs in people with immunocompromised states. Symptoms of endophthalmitis include severe eye pain, vision loss, discharge, and intense redness of the conjunctiva. Hypopyon or inflammatory cells in the anterior chamber of the eye may be present as shown in the picture in the slide. In endogenous endophthalmitis, systemic signs and symptoms may be present. Red eye is a condition that we often encounter in our practice. Does all the condition need referral? This slide will summarize the red flags that we should look for when patients present with red eye. Thank you for listening to part 1 of the eye module. Part 2 of this module will be presented in the next video.